I'm about to reveal something that could save you thousands of dollars every single year. Most people choose the wrong Medicare plan and don't even realize it until it's too late. By the end of this video, you'll know exactly how to avoid that mistake. Here's what nobody tells you. Medicare isn't just one plan. It's actually a complex system with multiple parts, and choosing wrong can drain your bank account faster than you'd believe. The average person loses over $3,000 annually just because they picked the wrong option. Why does this happen? Because the Medicare system is deliberately confusing. Insurance companies don't want you to understand it. They profit when you're confused. But I'm going to break it all down in plain English so you can make the smartest choice for your situation. Let's start with the basics. Medicare has 4 main parts, and understanding each one is critical. Part A covers hospital stays. Part B handles doctor visits and outpatient care. Part C, also called Medicare Advantage, is a private insurance alternative. Part D covers prescription drugs. Each part works differently and costs differently. Now here's where people make their first mistake. They assume Original Medicare, which is Parts A and B, covers everything. It doesn't. Not even close. Original Medicare leaves massive gaps in coverage that can bankrupt you if you're not careful. What gaps am I talking about? Original Medicare doesn't cover dental care. It doesn't cover vision care beyond certain eye diseases. It doesn't cover hearing aids. It doesn't cover long-term care in nursing homes. And here's the big one, it has no out-of-pocket maximum. That means if you get seriously ill, your costs could be unlimited. This is why most people need supplemental coverage. You have 2 main choices here. You can get a Medigap policy, which fills the gaps in Original Medicare. Or you can choose Medicare Advantage instead, which bundles everything together. Each option has serious pros and cons. Let me explain Medigap first. These are standardized plans sold by private insurance companies. They're labeled with letters like Plan G, Plan N, and so on. The coverage for each letter is the same no matter which company sells it. The only difference is the price. Here's what makes Medigap attractive. You can see any doctor who accepts Medicare. No networks. No referrals needed. You have total freedom. Plus, Medigap plans help cover those out-of-pocket costs that Original Medicare doesn't pay. Deductibles, co-payments, co-insurance, they're all reduced or eliminated. But Medigap has downsides too. The premiums can be expensive, sometimes $300 per month or more. And Medigap doesn't include prescription drug coverage. You'll need to buy a separate Part D plan for that. So you're juggling multiple policies and paying multiple premiums. Now let's talk about Medicare Advantage. This is where private insurance companies take over your entire Medicare coverage. They get paid by the government to provide your benefits. These plans often include extras that Original Medicare doesn't cover, like dental, vision, and hearing care. Medicare Advantage sounds great on paper. Many plans have low monthly premiums, sometimes even $0. They include prescription drug coverage built in. They have out-of-pocket maximums that protect you from catastrophic costs. And they throw in perks like gym memberships and over-the-counter allowances. So what's the catch? There's always a catch. Medicare Advantage plans use networks. You must see doctors within the network or pay much higher costs. You need referrals to see specialists. If you travel frequently or spend winters in another state, your coverage might not follow you. And the plans can change their networks and coverage every single year. Here's a real example of how this matters. Let's say you choose a Medicare Advantage plan because it has a $0 premium. Sounds perfect. But then you need hip replacement surgery. Your surgeon isn't in the network. Now you are facing thousands in out-of-network costs that you wouldn't have with original Medicare and Medigap. Or consider this scenario. You have Medicare Advantage and you're diagnosed with cancer. You want to go to a top cancer center for treatment. But that center isn't in your plan's network. You either pay massive out-of-pocket costs or you settle for a different facility. With original Medicare and Medigap, you could go anywhere. This is why your choice depends heavily on your personal situation. Are you healthy and don't see doctors often? Medicare Advantage might save you money. Do you have chronic conditions and see specialists regularly? Original Medicare with Medigap might be better. Do you travel a lot? That changes the equation again. Let's talk about prescription drug coverage because this trips people up constantly. If you have original Medicare, you must buy a standalone Part D plan for drug coverage. If you skip it and enroll later, you'll pay a penalty for every month you were without coverage. That penalty lasts for life. Choosing a Part D plan requires homework. You need to look at the plan's formulary, which is the list of covered drugs. Make sure your medications are included. Check what tier they're in because that determines your copay. Look at the pharmacy network to ensure your preferred pharmacy participates. Here's a critical mistake people make. They choose the cheapest Part D plan without checking if their drugs are covered. Then they go to fill a prescription and discover it's not on the formulary. Now they're stuck paying full price until the next enrollment period when they can switch plans. The costs vary wildly between Part D plans. The same medication might cost you $20 per month with one plan and $200 with another. Multiply that by all your prescriptions and the difference can be thousands of dollars annually. This is why you must compare plans based on your specific medications. Timing is another crucial factor. You have a 7-month initial enrollment period around your 65th birthday. 3 months before, the month of, and 3 months after. If you miss this window, you might face late enrollment penalties. For Part B, that penalty is 10% of the premium for each year you were eligible but didn't enroll. That penalty continues for as long as you have Medicare. If you delay 5 years, you're paying 50% more for Part B for the rest of your life. On a premium of $170 per month, that's an extra $85 monthly. Over 20 years, that's more than $20,000 in unnecessary costs. But there are exceptions. If you're still working and have employer coverage, you might be able to delay Medicare without penalty. The key word is might. The rules are complex and depend on your employer's size and how their insurance coordinates with Medicare. Get this wrong and you'll pay dearly. Now let's discuss the annual enrollment period, which runs from October 15th to December 7th every year. This is when you can switch from original Medicare to Medicare Advantage or vice versa. You can also change your Part D plan or switch Medicare Advantage plans. Use this time wisely. Why would you switch? Maybe your Medicare Advantage plan changed its network and dropped your doctor. Maybe your medications changed and your Part D plan no longer covers them affordably. Maybe you moved to a new area where different plans are available. Life changes and your Medicare coverage should change with it. Here's something most people don't know. Medicare Advantage plans can change their benefits every year. The plan you loved last year might cut benefits or raise costs this year. You need to review your coverage annually during the enrollment period. Don't just auto-renew and assume everything's the same. Costs are obviously a major consideration. Let's break down what you'll actually pay. Part A is usually premium-free if you or your spouse paid Medicare taxes for at least 10 years. Part B costs $174.70 per month in 2024 for most people. Higher earners pay more based on their income from 2 years ago. Medigap premiums vary by plan type, your age, where you live, and which insurance company you choose. Plan G, one of the most popular options, typically costs between $150 and $300 monthly. Part D plans range from about $7 to over $100 per month depending on coverage level. Medicare Advantage premiums are often lower, sometimes zero. But remember, you still pay the Part B premium. And Medicare Advantage plans have copays and coinsurance for services. A hospital stay might cost $400 per day for days 1 through 5. Doctor visits might be $20 to $50 each. These costs add up quickly if you need a lot of care. Let me give you a comparison. Say you're relatively healthy. With Original Medicare, Medigap Plan G, and Part D, you might pay $450 monthly in premiums. With Medicare Advantage, you might pay only $200 monthly. That's a savings of $3,000 per year. But if you get sick, those Medicare Advantage copays could easily exceed that savings. On the other hand, if you have serious health issues, Medigap might save you money overall. Yes, the premiums are higher. But your out-of-pocket costs for care are minimal. You won't hit surprise bills. You won't worry about network restrictions when you need specialized care. For peace of mind and financial protection, many people find this worthwhile. Here's my advice for making your decision. First, list all your current medications and doses. Second, identify your doctors and specialists. Third, estimate how often you need medical care. Fourth, consider your budget for both premiums and potential out-of-pocket costs. Fifth, think about your lifestyle and whether you travel or have homes in multiple states. Use the Medicare Plan Finder tool on Medicare.gov. Enter your medications and it will show you exactly what each Part D plan will cost you annually. It's incredibly helpful and completely free. Don't rely on insurance agents alone because they have incentives to sell certain plans. Speak with an unbiased Medicare counselor through your state health insurance assistance program, called SHIP. These counselors don't sell insurance. They provide free, objective advice. They can help you understand your options and compare plans based on your specific needs. Every state has this program. Be wary of high-pressure sales tactics. Some agents push Medicare Advantage plans aggressively because they earn higher commissions. They might downplay the network restrictions or the fact that benefits can change yearly. They might not mention that switching back to Original Medicare later can be difficult because Medigap insurers can deny you coverage based on health conditions. That's a huge point. When you first become eligible for Medicare, you have guaranteed issue rights for Medigap. Insurance companies must sell you a policy regardless of your health. But if you choose Medicare Advantage initially and want to switch to Medigap later, insurers can reject you or charge you more if you have health problems. This means your initial choice carries long-term consequences. If you start with Medicare Advantage and develop serious health conditions, you might be stuck with it. You won't be able to switch to the potentially better coverage of Original Medicare with Medigap. Think carefully about this before making your decision. What about dental, vision, and hearing? Original Medicare doesn't cover routine care for these. Medigap doesn't either. Medicare Advantage often includes some coverage, but it's usually limited. You might get one eye exam per year and a small allowance toward glasses. Dental might cover cleanings but not major work like crowns or implants. If you need extensive dental work or already wear hearing aids, factor these costs into your decision. You might need to buy separate dental and vision insurance. Or you might choose Medicare Advantage specifically for these benefits, understanding that you're trading network freedom for extra coverage. Let's talk about special situations. If you have end-stage renal disease, your options are limited. You generally must stay with Original Medicare unless you qualify for certain Medicare Advantage plans. If you have both Medicare and Medicaid, you're dual eligible and have access to special plans designed for your situation. If you're still working past 65, coordinate carefully with your employer's HR department. Understand how your employer coverage works with Medicare. In some cases, you should delay Part B. In others, you need to enroll right away. Get this wrong and you could lose coverage or face penalties. One more critical point. Medicare doesn't cover long-term care in nursing homes. Neither does Medigap. Neither does Medicare Advantage beyond short-term skilled nursing after a hospital stay. If you need custodial care for months or years, you'll pay out of pocket unless you have long-term care insurance or qualify for Medicaid. This is a separate decision from your Medicare choice, but it's important to understand. Many people assume Medicare will cover nursing home care and are shocked to discover it doesn't. A nursing home can cost $8,000 to $10,000 per month. That will devastate your savings quickly. So what's the bottom line? There's no single right answer for everyone. The best Medicare plan for you depends on your health, your budget, your doctors, your medications, and your priorities. What works for your neighbor might be terrible for you. Do your homework. Use the online tools. Talk to unbiased counselors. Compare multiple options. Read the fine print. Understand what you're getting and what you're giving up. This decision affects your health and your finances for years to come. Don't rush it. Don't let anyone pressure you. Take the time to make an informed choice. And remember, you can change your mind during the annual enrollment period if your situation changes or if you realize you made a mistake. The Medicare system is complicated by design. But now you have the knowledge to navigate it successfully. You understand the parts, the options, the costs, and the trade-offs. You know the questions to ask and the mistakes to avoid. Armed with this information, you can choose the Medicare plan that truly fits your needs and protects your budget. Make your decision wisely and you'll thank yourself for years to come.